Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Stomach disorders. Introduction. The stomach is an organ between the esophagus and the small intestine. There are many disorders that can affect the stomach. Treatment depends on the cause. Sometimes over-the-counter medicines or changes in diet can help. Other times, prescription medicines or surgery may be needed. This program explains common stomach disorders, their symptoms, and treatments. The stomach. The stomach is a hollow organ. It is located in the upper abdomen, under the ribs. The stomach is part of the digestive system. The digestive system includes organs that take in food and turn it into products that the body can use to produce energy and stay healthy. After digestion, products that cannot be used by the body leave the body through bowel movements. Swallowed food first goes through the esophagus. This tube takes the food to the stomach. Acid and enzymes are secreted by the stomach to digest food, turning it into liquid. Muscles in the stomach push the liquid into the small intestine. The wall of the stomach is made up of many different layers of tissue. General symptoms. Symptoms of stomach disorders can vary widely and depend on the problem. The most common symptoms of a stomach disorder are heartburn and nausea. Other common symptoms of stomach disorders are abdominal pain, burning stomach pain that may come and go, poor appetite, unintended weight loss, vomiting or diarrhea. Some stomach disorders may also cause back pain, bloating or excess gas, bloody stools, dry cough. Stomach disorders can cause other symptoms as well. If you notice any of these symptoms or other changes, talk to your healthcare provider.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Heartburn and GERD. Almost everyone has heartburn sometimes. Heartburn is a painful burning feeling in your chest or throat. Heartburn happens when stomach acid backs up into your esophagus. Often heartburn is caused by eating certain foods, such as fatty and fried foods, garlic and onions, spicy foods, tomato-based foods such as spaghetti sauce, salsa, and pizza. Other foods that can cause heartburn are chocolate, citrus fruits, drinks with caffeine or alcohol, mint flavorings. If you have heartburn more than twice a week, you may have GERD. GERD stands for gastroesophageal reflux disease. It is the most common disorder that affects the esophagus. GERD happens when the muscular ring at the end of the esophagus does not close properly. This allows stomach contents to flow back or reflux into the esophagus and irritate it. GERD can cause damage to the esophagus over time. The same foods that cause heartburn can cause or worsen symptoms of GERD. GERD may also be caused by being overweight or pregnant. Other medical conditions, such as hiatal hernias, increase the chances of having GERD. Hiatal hernias cause the top part of the stomach to bulge up. This means the top part of the stomach is in the chest area. In these cases, the diaphragm can't help stop reflux. The first treatment for GERD is often lifestyle changes, such as eating small meals frequently throughout the day instead of eating large meals, eating at least 2 hours before bed, elevating the head of your bed about 6 inches, quitting smoking. Sometimes medicines may be taken to decrease the acid in the stomach. Some medicines are available over the counter. Others require a prescription. Rarely, severe cases of GERD may be treated with surgery. Different types of surgery are used. Peptic ulcer. A peptic ulcer is a sore or erosion in the lining of your stomach or duodenum. The duodenum is the first part of your small intestine. Many people have peptic ulcers. Nearly 1 in 10 people will develop an ulcer at some time. Peptic ulcers are common throughout the world. People may have more than one ulcer during their lifetime. Peptic ulcers often cause a dull or burning pain in your stomach. If left untreated, peptic ulcers can cause other, more serious health problems. A peptic ulcer in the stomach is called a gastric ulcer. One that is in the duodenum is called a duodenal ulcer. Peptic ulcers also may develop just above your stomach, in the esophagus, but this is rare. Most peptic ulcers are caused by bacteria that cause infection, known as Helicobacter pylori or H. pylori. H. pylori may be spread through unclean food or water, or by mouth-to-mouth contact, such as kissing. But many people who have an H. pylori infection never develop an ulcer. Non-steroidal anti-inflammatory drugs, or NSAIDs, such as aspirin and ibuprofen, are also a common cause of peptic ulcers. Ulcers caused by NSAIDs are usually found in people who are aged 60 years or older, are female, have had an ulcer before, have taken NSAIDs for a long time. If you have a peptic ulcer, it can be treated and even cured. Depending on what caused your ulcer, your healthcare provider may prescribe a number of different medicines. If an H. pylori infection caused your peptic ulcer, your healthcare provider may prescribe antibiotics. Antibiotics are medicines used to treat bacterial infections. If an NSAID caused your peptic ulcer, your healthcare provider may tell you to reduce how much of the NSAID you take. Stop taking the NSAID. Switch to another medicine that will not cause ulcers. Take medicine to reduce stomach acid. Rarely, surgery is needed to help ulcers heal. You may need surgery if your ulcers keep coming back or causing complications, such as blocking food from moving out of the stomach. Gastritis. Gastritis is a condition in which the stomach lining, or mucosa, is inflamed. The stomach lining contains special cells that produce acid and enzymes. These help break down food for digestion. The lining also creates mucus, which protects the stomach lining from acid. When the stomach lining is inflamed, it produces less acid, enzymes, and mucus. Sudden severe inflammation of the stomach lining is called acute gastritis. Inflammation that lasts for a long time is called chronic gastritis. If chronic gastritis is not treated, it may last for years. Erosive gastritis is a type of gastritis that often does not cause significant inflammation, but can wear away the stomach lining. Erosive gastritis can cause bleeding or ulcers. Gastritis may be caused by H. pylori infection. This is the most common cause of non-erosive gastritis. Prolonged use of NSAIDs. This is the most common cause of erosive gastritis. Erosive gastritis may also be caused by alcohol, cocaine, radiation. Traumatic injuries, critical illness, severe burns, and major surgery can also cause acute erosive gastritis. This type of gastritis is called stress gastritis. Less common causes of gastritis include autoimmune disorders in which the immune system attacks healthy cells in the stomach lining. Some digestive diseases and disorders, such as Crohn's disease. Viruses, parasites, fungi, and bacteria other than H. pylori. In severe cases, gastritis can cause complications. Some of these complications include gastric tumors, peptic ulcers, stomach cancer. Medicines that reduce the amount of acid in the stomach can relieve symptoms and promote healing of the stomach lining. These medicines are available over the counter and with a prescription. Stomach cancer. Problems in the stomach may also be caused by cancer. Cancer begins in your cells, which are the building blocks of your body. Normally, your body forms new cells as you need them by replacing old cells that die. Sometimes this process goes wrong and a tumor forms. If a tumor is cancerous, cells from the tumor can invade other tissues throughout the body. Cancer cells can spread to different parts of the body through blood vessels and lymph channels. Cancers in the body are given names depending on where the cancer started. Cancer that begins in the stomach will always be called stomach cancer. This is true even if it is spread to other places in the body. Stomach cancer is a common type of cancer. Stomach cancer usually starts as an overgrowth of normal cells. These growths are called polyps. Cells in polyps may continue to grow out of control and can become cancerous. They should be removed as early as possible. Certain factors increase the risk of getting stomach cancer. These risk factors include a family history of stomach cancer, eating a lot of foods that are smoked, salted, or pickled, having certain bacterial infections in the stomach, lack of exercise, smoking. People who have had part of their stomach removed for ulcer disease or have long-term inflammation of the stomach are also at an increased risk of stomach cancer. Most people receive more than one type of treatment for stomach cancer. Treatment may involve surgery, chemotherapy, radiation therapy.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. The stomach is an organ between the esophagus and the small intestine. The stomach is where digestion happens. There are many disorders that can affect the stomach, including heartburn and GERD, peptic ulcer, gastritis, stomach cancer. The most common symptoms of a stomach disorder are heartburn and nausea. Other common symptoms are abdominal pain, burning stomach pain that may come and go, poor appetite, unintended weight loss, vomiting or diarrhea. Treatment depends on the cause. Sometimes over-the-counter medicines or changes in diet can help. Other times, prescription medicines or surgery may be needed. Treatment may include chemotherapy or radiation therapy if the cause is cancer. Thank you for using Explain.